But I do have something to confess to you guys. I actually quit my dental assisting job. But let me tell you why.
And I thought as a general dentist I could do a little bit of everything.
Don't do it for the money. It's not a huge money maker.
Trying to become a dentist, get good grades, get into dental school, work hard. But while you're in dental school, my best advice is
Hi friends, welcome back to my channel, welcome back to another video. A lot of you really loved my day in the life of a New York City dental assistant vlog, so I thought that I would record something else while I was working as a dental assistant still. But I do have something to confess to you guys. I actually quit my dental assisting job. But let me tell you why. So as some of you may know, I am going to be starting dental school within the next couple of weeks. And since my school is relatively far from where I used to work in Brooklyn, and also because dental school is pretty overwhelming in terms of the rigorous course load and the amount of work that you have to do and the amount of studying that you have to do, 95% of people that I've talked to do not recommend having any kind of job during dental school. And so that's why most people will tend to take out loans in order to cover their expenses while they're in school, because holding down a job and having that kind of responsibility while having to put in, hours and hours every day studying for all of your exams is a bit overwhelming. So much like everybody else, I decided not to do that to myself, and so I actually left my dental assisting job. But before I left, I decided to record a last day in the life as an assistant, and I actually have some really cool procedures to show you guys. I got to work with Dr. Erlin and Dr. Suller, which you guys haven't seen in my last vlog, so that was really cool. And then as a last kind of farewell snippet, I actually got to ask the other dentists that I work with for some advice for you guys. So I hope you guys enjoy it. And if you're new here, hi, my name is Medina. I make videos for pre-dental students, and I would love it if you could subscribe down below and like this video.
Hi. Good. You're leaving the board.
Yeah.
You're so cute.
I was like, I didn't want to bring a cake because I knew there was going to be a cake because I was going to make something. And I was like, you know what, what's different? Let me be different.
That is so cute. I love that.
I was going to be all extra and make roses out of the cold cuts, and I was like, I don't got time for that. That's not. Because you see the TikTok hack where they put it inside a wine glass and they make a rose out of it?
Yeah.
So here is a surgical procedure that I got to do with Dr. Erlin on my last day, and we were doing an extraction of 2 teeth as well as a bone graft in preparation for implant placement within the next couple months. So here Dr. Erlin is taking out all the instruments ready for the procedure. For surgical procedures, we tend to set everything out on a tray. And then he grabs everything that he needs and puts aside anything that he doesn't need, and everything is just ready for the doctor to take. And I just grabbed a surgical suction and got ready for the procedure. The thing with assisting surgical procedures is that most of the time the assisting part is actually pretty simple, and the most challenging part is getting everything right and make sure you have all the instruments, because surgical procedures do tend to be more instrument heavy than other procedures, so you want to make sure that you have everything at hand, whether that's the instruments for extractions or bone grafts, or the stuff for afterwards if you need to put suturing, or add bone or membrane or anything like that. Dr. Erlin is using elevators and a Minnesota retractor to try to get mobility on the teeth, and then he will go in with forceps once the teeth are mobile enough and take them out. One of the teeth is actually severely broken down after an infection. So what he intends to do there after he takes out an infected tooth is use a curette to scrape off any of the infected tissue, and use a rongeur to pull off some of the soft tissue as well that was infected, to make sure that there's only healthy bone left before we place the bone graft in there. and let it heal for a few months. So this patient actually was telling us that she's going on vacation for a month. So usually for surgical procedures, when we place sutures, we have the patient come back after 2 weeks in order to remove the sutures. But for her, since she is going away for an entire month, we wanted to place sutures that are going to dissolve by themselves, and those are called chromic gut sutures. And those are actually resorbed by the body, and they just come out within a couple of weeks themselves. So now that the teeth are out, we're setting up for the bone graft. So I just went and grabbed a sterile syringe, and I'm filling it with sterile saline solution, and that is used to irrigate the dry bone graft, as well as the membrane that we use to cover the bone in order for the gum to heal over it. I'm also taking out the sutures right now and getting them ready, putting them in the needle holder so they're easier for the doctor to grab afterwards. And he's just grabbing the bone and getting the membrane ready. He irrigates them with a little bit of saline so that they're a little bit more pliable when putting them into the area where the tooth is just extracted. And I also grabbed a few cotton-tipped applicator, which is kind of like a Q-tip, because with bone grafts, once the bone goes in, you cannot suction anymore. Because if you're trying to get some of the excess blood or saliva out of the way, you can actually suck out some of the bone, which not only wastes the materials, it makes you start the process all over. So what we do is we will actually just place the cotton tip applicator, and it will take out any of the blood or any fluids in the area through capillary action. And it's pretty cool to see because it's a white cotton tipped applicator, and once you place it on the site, you can actually see the blood being taken out, and then it dries it out enough so that you can pack more bone in and get a good visual of the area. So now here you can see Dr. Erlin is placing the sutures. So he uses the Minnesota retractor to retract the gum and the cheek out of the way when he's placing the sutures, which are just stitches. And so once he places the initial stitch, he'll have me hold the Minnesota retractor so that he can use both hands in order to tie the knots. So certain dentists will prefer to hand tie the knots, whereas other dentists will use the needle holder to tie them. Dr. Erlin prefers to use the needle holder, and I've actually always found it really impressive how quickly he can do this, just because it looks very easy and seamless, but it's actually much more difficult. I tried myself when we had some spare stitches around. I took one of our little stress balls and I tried to suture it myself, and it was actually pretty difficult. So I love how seamlessly he does that, and being able to assist in these surgical procedures has really given me a great insight as to how these procedures are done for the future. So after the procedure, we give all patients an ice pack to limit the swelling and the irritation in the area. And then also, as assistants, we tend to go over the post-op instructions with the patients. We do give them a sheet with everything that they should and shouldn't do in the next 24 hours after any kind of surgical procedure. But we like to go over things such as, and then we follow up with them by giving them phone calls. And then we see them usually in 2 weeks after the procedure when they come back for suture removal to make sure that everything is healing properly. So here's another really cool procedure that I'm getting to do with Dr. Stuhler. So we're actually performing what's called a gingivectomy, which is just a removal of excess gums that we're actually doing with a laser, which is super cool. And there are several different uses for dental lasers. Our hygienists sometimes use them to debride deep pockets if a patient has perio. We also do frenectomies in the office, which is just trimming the part of your gum that connects to your lip to your actual gums. And so here we're doing a gingivectomy because this patient had a lot of inflammation around her gums. We actually did a really comprehensive case on her where Dr. Zuller did a full mouth restoration pretty much. She's a very young mom and she had neglected her teeth, so this was a very, very rewarding case that we did for her. And we were able to use a laser to trim the excess gum because we were actually putting in a 6-unit bridge on the lower interior teeth, which are the front teeth. And so for this case, we trimmed the gums a little bit to make not only the bridge fit better, but also to improve the appearance and the health of the gums, because the laser does help to debride some of the infected areas and improve healing. So our last patient of the day was actually my sister. She stopped by at the office for a cleaning a couple weeks ago, and we did notice some cavities. And so Dr. Suller decided, even though they were pretty small, to do them because my sister does live pretty far away. She only comes to visit us in the summers. So it was really nice to kind of round things out and have her be the last patient. And we were able to talk, and I love the fact that while we work, we can always have conversations with our doctors. And throughout my time here, it's been really rewarding and interesting to get to know the doctors and get to talk to them about interesting concepts. Like here, we were talking about the fact that apparently on the boards during dental school now, they require a different method for detecting caries than most dentists are used to. So usually you probe with a explorer into the site where you think there's caries, and then that's how you diagnose it. Whereas now you're supposed to just use a visual in order to diagnose it, and we were discussing that now with Dr. Suler. But it was just really nice to be able to, do this for my sister and have her come to the office while I was still there on my last day, and it was a nice way to kind of round things out and finish out my time working at the office that I personally have been a patient at for years and that I've learned so much at.
Okay, so this is Dr. Erlin, one of the other doctors in the practice. He does most of our surgical procedures like implants and the sinus lifts and things like that. So this is Dr. Suler, one of the other doctors that I work with. She's one of the owners of the practice with Dr. Erlin and Dr. Gelfin. This is Dr. Elena Lang. She's one of our pediatric dentists. Well, she's the only pediatric dentist we have in our office. She's here once a week usually.
I don't think I decided to go into dentistry. I think it just happened.
Okay.
I started working in a dental office and I said, wow, I love this. And then I went to hygiene school and I said, wow, I love this. And then I just continued going for it.
Okay, good answer.
I liked going to the dentist when I was little. I thought it was really, really cool and really, really fun. I thought I'd get to play doctor and be a hero, have a problem, fix it, and feel good about it. And that's why I decided dentistry is for me. Plus I thought I could be good with it, and I thought I could, enjoy working with my hands, and I thought I could like working with people and helping people. So yeah.
So I wanted to always do something in medicine. Dentistry is something that's hands-on. I happen to play the violin, so it's pretty, you need
It's a dexterity skill. Yeah.
So it kind of, the two things kind of fell into place. So that's pretty much. Go into dentistry if you really want to do it. Do it for the love of being a doctor. Do it for the love of giving care to patients. Don't do it for the money, even though you might have a comfortable living, but it's not a huge moneymaker. So you do it for the right reasons, and you'll love it.
I think you really need to feel for what dentistry is. So just like Medina, you worked in a dental office, I worked in a dental office. I think you need to firsthand see and feel what dentistry is before you make that kind of a decision.
Definitely.
And talk to some dentists, obviously.
Yeah, there you go. It's a big commitment.
Trying to become a dentist, get good grades, get into dental school, work hard. But while you're in dental school, my best advice is make a really, really good friend. At least one, maybe two, maybe three, maybe four. And they will make your experience so much better. You're gonna enjoy it, you're gonna work together, you're gonna help each other, you're gonna study together, do lab work together, and who knows, maybe open a business together.
Yeah, that's what happened with you, right?
No.
No regrets?
No regrets. all perfect. I rushed. I did 3 years of undergrad, so I thought that was a great decision initially. Then I thought it was a bad decision because why did I rush? I should have taken my time. And now looking back, everything happens for a reason. I wouldn't have had my best friends that I have now, which I met in dental school. If I had gone a different year, and they wouldn't be my partners. So yeah,
Good.
Wouldn't change a thing.
As many things as there are that I think we want to change, I think that it's not just the destination, it's the journey itself. And I think I've made some other decisions in my journey that I wouldn't have. I've met some people that had changed my life, and I think that even just having kids while studying for all my exams was an amazing thing that I would never take back.
I personally, I always say what happens for the best.
So no regrets.
No regrets.
Nice.
I always liked surgery, implantology, so I did 1 year of general practice residency. I just figured any more time spending in residency or school is just way too ridiculous. So, 1 year, plus 4 years of dental school, 4 years of undergrad.
Yeah.
More than enough.
It adds up.
Yeah.
Well, first of all, I was done with school. I wanted to get out and work and be done. Also because there was not one thing that I really liked more than anything else, and I thought as a general dentist I could do a little bit of everything and I wouldn't be locked into one thing. A little bit of everything. Something where I have immediate gratification is great.
Pediatric dentistry requires a little bit of a longer residency. It's a little bit more of a commitment. So at one point, did you decide that you wanted to pursue a specialty?
I always liked working with children. I went to a residency program that had an amazing pediatric program and an amazing director of pediatrics, and it just made me fall in love with pediatric dentistry, and I just couldn't not do.
Yeah, and you were also a mom in dental school, so maybe that helped as well. The maternal instinct. I wanted to ask about that because you kind of have a unique perspective on that you had 2 kids while in school. And actually in my first video I kind of talked about that, where people were giving me the same kind of a question. Oh, when are you going to have kids? It's like putting me on a timeline of, you're going to spend so many years in school. What's your perspective on having kids while in dental school?
It depends. If you gotta do it, you just do it.
Yeah. But would otherwise, like, if you had the opportunity, would you wait until after? Do you say that, like, it made it more difficult, or were you able to manage your time better because of that?
I'm not sure. I think people who were in school and did not have children, they had a lot more fun in school and they were probably exploring so many more opportunities that I just didn't have the time for.
Definitely.
But I will tell you, my friends who had children in dental school, they were very focused. They had to get things done because they had other obligations.
Absolutely.
And they were a lot more focused on actual work.
Definitely, I think.
Yeah.
So as a female dentist and female boss, I've asked Dr. Lang this, and I want to ask you too. How do you feel about kids during dental school or residency? Did you think it was tough to, because you had your oldest in residency? Would you recommend it? Would you say wait until you're done? Because it's always a question that seems to be addressed toward female dentists.
I don't think there's a best time to have a kid in general. It's different for everybody, and it happens, I feel like. I don't think it's a great thing to do during dental school, because then you miss out on a lot of experiences of being a dental student. It's very overwhelming, but if it does happen, you make it work. But having a kid, having a baby at the end of residency was actually a good transition, so it worked out well.
Okay, well, thank you for answering the questions. And if you guys want to see Dr. Suler or any of our other doctors, feel free. I'm going to link the website down below one more time. So if you guys want to have great dentists in Brooklyn, come see us.
Thank you.
There was also a teary goodbye party that I didn't include in here, but that was basically my last day ever working as an assistant. I don't know, maybe throughout the course of the next 4 years as I'm in dental school, maybe I'll pick up, a part-time job as an assistant here and there. But I think that was kind of like a solid bookend to my experience. So, I hope you guys enjoyed the video. Remember, don't forget to like and subscribe and stay tuned for more videos. Let me know down in the comments what kind of content you guys want to see from me now that I'm starting dental school. If you're interested in sort of like a weekly vlog, you want to see things that I do in the labs, I'd really love to hear your thoughts on that. And then, again, thank you for watching. Don't forget to like this video and subscribe down below, and stay tuned for more. I really appreciate every one of you guys that is watching, that is leaving comments, that is subscribing. It means the world to me. And I will see you soon. Bye.